This is Chris Lenois, host of the live and local program on WKVT 100.3 FM and AM 1490. Instead of our regular program of news, information, and community that airs weekdays from 9 a.m. to noon, today we are pleased to present a call to action, a special forum about heroin addiction and drug-related crime in the Brattleboro area. We are broadcasting live from the meeting room of Brooks Memorial Library, where a number of panelists and audience members are gathered to help us have this conversation. Joining me as co-moderator for today's program is the Classic Hits 92.7 morning host, Fish. This special program was his idea and was made possible by his hard work coordinating with the guests we have today. So I'll let him set the stage. Morning, Fish.
Good morning, Chris. Thank you, and I want to thank everybody for coming out today. Of course, again, this is open to the public. It's free of charge. If you have questions from 9 till noon today, we will be here. And the point of today's program is, well, in a perfect world, would be to educate and empower our citizens to help with the fight against addiction to opiates and also heroin. I would hope that we would give out information that will educate, motivate, and activate the citizens of Brattleboro to do something to help those who are on the front lines fighting this battle on a daily basis. Throughout the morning, we will be joined by many people with firsthand knowledge of the day-to-day dealings that will span from the use, the access to it, and right down to the incarceration of those dealing. For our first hour today from 9 to 10, we'd like to welcome Commissioner Harry Chen, who took the long drive down from our state capitol, Lieutenant John Merrigan from the Vermont State Police, who is in the Narcotics Investigation Unit, and Vermont State Attorney Tracey Shriver. So welcome all of you to the program. Thank you for being a part of our forum today. And Chris, you'll get the party started.
Yeah, I thought we would start off with a toss-up question kind of situation here. Obviously, the reason that we're having this conversation in the state of Vermont, it all began back in January with Governor Shumlin's State of the State address. And some were surprised he chose such a singular topic for what is traditionally an opportunity to speak broadly about issues facing the state. And I'm interested in each of yours perspective on what factors you think led him to taking this approach. And Dr. Chen, I'm hoping we can start with you in terms of answering that question.
Sure, Chris. I think I really want to just kind of step back and pause a bit because
Sure.
The reality is that it started before January, and that we've been living this for years. And what the governor did, which was granted very bold in terms of a political statement, what he did was to take it out of our backyards, bring it into our front yards, take it out of our basements, bring it into our living rooms. So that's the important thing that he did. And I thank him for that because there are a lot of us, I'm sure all the people up here in the panel and many of the people in the room that have been working hard at this for years. But now I feel like we're moving all together in a very public way to our advantage to try to address this problem.
So it was really a matter of having to bring the conversation out in the open, not anything that escalated at a particular time that led him to make this the focal point.
Well, I think there clearly is evidence that things are escalating, and some of the ways that it's been escalating are the transition from prescription drugs, which was really the last problem, or the continuing problem, but much more toward heroin. And some of that may be an economic phenomenon, and the profound increase in treatment numbers in terms of people who are addicted to heroin. So there is change. There always will be change. But I also think that this is something we're going to constantly need to struggle with and try to address throughout the spectrum of how we would normally deal with any public health crisis, whether it be prevention, early intervention, treatment, law enforcement, and ultimately recovery. So we need to take care of all those pieces to really address this in a satisfactory fashion.
Ms. Shriver, let me ask you that question too in terms of Governor Shumlin making that State of the State, and was that a wake-up call for the state's attorney's office in any way as to the nature of the issue or how we needed to change addressing it?
Well, I would agree with Commissioner Chen. It was certainly something that the state's attorneys throughout our state were aware of. But I do applaud the governor for focusing so singularly on that issue. He, in fact, invited all the state's attorneys, all 14 state's attorneys, to attend his State of the State address. And I think, at least will speak for myself, I was very happy that he decided to focus so singularly on one issue. But what's important to me as a state's attorney is he focused on the health crisis. He focused on prevention and treatment, but he also focused on law enforcement and toughening up some of our criminal laws as it pertains to people who use and people who sell illegal
So it was
drugs.
something that was already in the purview of the state's attorney's office in terms of thinking about this not only as a criminal problem, but a health crisis as well, as he characterized it.
Absolutely. And as the governor focused a lot of his remarks about the Chittenden program for rapid intervention with folks who are find themselves in the criminal justice system because of their addiction, we as state's attorneys were aware of and probably all envious of the model that Chittenden was allowed to have because they are the biggest county. And I think that you would find if you surveyed all the counties, including our own county here in Windham, we're all working to come up with a rapid intervention pre-court process. And I think that the governor's speech was excellent in motivating folks to get on that track.
Yeah. Lieutenant Merrigan, when Fish mentioned people on the front lines of this epidemic that's hitting Vermont right now with heroin addiction, certainly the work that the Vermont State Police, you are right there on the front lines. What did it sound like to you, Governor Shumlin was saying to you and the other state troopers when he was talking about this in terms of a chronic health problem in addition to a law enforcement issue?
Yeah, no, it wasn't, I agree with them. It wasn't an eye-opener for us because we've been doing this for some time and looking at the heroin issues for some time. What it did, though, is it sharpened the focus on this three-prong approach, which has been in place for a while, but now I really feel like it's more of a partnership than it's ever been. The education component, the rehabilitation component and treatment, along with a law enforcement component. You can't do anything without these three working together. There's no teeth if we are not out holding people accountable. But holding people accountable and then sending them back out on the street after you give them a citation, because that's how we do misdemeanor possession here in Vermont, that's not holding anybody accountable either. So it really sharpened the focus broadly, and for us it just gave us a little bit of support on what we've been doing for quite a while, for the last 2 years, almost nonstop.
Now, as I was doing, putting the panels together and asking the questions and trying to delve in deeper, one of the things that had come up throughout law enforcement, and I'm trying to remember the term, is aggregate arrests. And can you explain to us how that works? Because that, to me, was interesting. So, as it's explained to me, and please correct me if I'm wrong, you can arrest a person for selling heroin, but as you said, it's a citation, and until you get a certain amount of busts before you can really do something that is impactful to that person to get them to stop. Am I off base with that?
Are you talking about sale investigations?
Yeah.
People are selling?
Yep.
No, you're not off, but I'll explain. Well, first off, if you're selling heroin, that's a felony, and that's not a citation. That would be an arrest, and you'd get processed, and you may even get called for bail. But ultimately, it's unlikely if you sold 2 bundles of heroin, 20 bags. It's unlikely that you're going to serve any jail time or even be held prior to after arraignment. So, but this aggregate amount, this multiple sales, this situation, this stemmed from. I wouldn't call it an old school way of doing drug enforcement, but showing a pattern of activity. And this really started with back in the 80s when the drug unit, and that's what I supervise as the narcotics unit, just undercover guys doing nothing but drug sales and drug investigations. You'd make a couple buys and arrest them, but if you didn't show a pattern of behavior, it was tough to sell to the judge. Like, this guy's a long-term seller. This is what he does. So we got away from those type of cases, but now the concept remains true. You've got to show a pattern, and especially with if one of our investigators knows he's got a significant heroin dealer, but we catch him selling heroin one time, and by catch him, he's either sold to one of us or to one of our informants that we're with, and we arrest him immediately. The defense is that he's an addict and he needed to sell to support his habit, and we should let this guy go. And if we leave it at that, then we don't bring his true actions to light. So what we'd end up doing is a pattern of investigations, do 3 sales, maybe more, maybe less, depending on the situation, and then try to present a case for the state's attorney's office that they can show the judge, look, this guy isn't supporting his habit. He just made $2,000. And that's where the big difference is. If you're making money selling heroin, that's different than a guy that is supporting his habit, in our opinion. Does that answer your question?
Yeah, it does. It just because I think it speaks to another problem that when you guys are putting the bad guys away, that they're just sort of getting pushed back out on the street sometimes, not all the times. We do have to take a break, but when I return, I would like to come back with a question for our state's attorney as to how that process works. And we'll be back. We are broadcasting live from the meeting room at Brooks Memorial Library here today until noon, and it's a call to action, and we actually call you to come on out and ask some questions today. We have an extra mic, and you can take the floor. You can be the 6th panel member here today if you'd like to. Brooks Memorial Library, meeting room, just come up the long steps, and we'll be back after these messages. Welcome back to A Call for Action. We're broadcasting live from the meeting room at Brooks Memorial Library. We left off talking with Lieutenant John Merrigan about some of his difficulties on the front line and how that translates into court time, jail time. Tracey Shriver, let me ask you, I mean, do you find that our judges are cooperative with keeping these people locked up? I mean, I know that's a high heat question, and I apologize for that. But I know that part of the problem may be some of the guys that are sitting behind the bench. And are we finding that to be true?
Well, let's back it up a little bit. Here in Vermont, and most people would consider this a very, very good thing, according to our Constitution and our state laws, there's only certain ways to have someone held on bail. And one of those ways, I think we would all agree, which is a good idea, is someone who commits acts of violence, felony-level acts of violence. Those sorts of people can be held without bail. When it comes to bail for risk of non-appearance, that's really all we're talking about. A judge can't set bail just because of the nature of the charge or just because of the amount of heroin someone's found with. What a judge always has to consider is whether or not this person is a risk of non-appearance. And it depends on who we're arresting. So if we're arresting a drug dealer, someone who's selling heroin in our community who's from Springfield or who's from New York, and I mean Springfield, Massachusetts, then we have a much better argument to make to the judge that this person is a risk of non-appearance. If we want to start changing that, if we want to say possession of heroin is something that judges should automatically consider as a bailable offense, that takes a much bigger change than anyone from my office arguing for bail or anyone wearing a robe making a decision. That takes everyone in Windham County talking to their legislators and talking about what really is important to us. We've already made the decision that acts of violence, felony-level acts of violence, are important enough to say, you know, we're going to hold those people without bail, we're going to restrict their liberty, but we haven't made that determination into just possession of drugs. And perhaps that's something we want to do. We often go in whenever there's a felony drug offense and argue for bail because we think the nature of the charge gives that person incentive to flee, but that's not always the strongest argument. So I wouldn't point fingers at anyone who's on the bench. I would say it's a system-wide look that we need to take at this and decide whether or not we want to change our laws and our Constitution.
Well, I think Fish's question and your answer to that, Ms. Shriver, actually really hits at one of the reasons to have this discussion on a community level when you're talking about that tension between community feeling safe and some of the day-to-day arrests one can make for users or low-level dealers, and then also trying to get at the source in situations. If I'm hearing you correctly, you're saying that there needs to be more tools at your disposal, and maybe at the tools of Lieutenant Merrigan's disposal as well, in order to make these sorts of changes happen, in order to make, to solve both of those issues at the same time. You want to make sure you prevent these heroin and other drugs coming into the community, and so you try and go to these people outside the community, but at the same time, that means you'll have other people on the streets, maybe these low-level people that you keep out there in order to try and catch the bigger fish.
Absolutely. I think that does happen. And not to say, I want to clarify too, when people are released on conditions, I know it can be frustrating to read in the newspaper or hear on the radio, this person just got arrested for selling heroin, this person got arrested for possession of heroin, and the very next day they're back out on the street. You see them back on the same corner you just saw them. It is because of our bail statutes in our Constitution, but you should know that the prosecutors and the judges are considering safety when they're releasing people on conditions. That's certainly something that factors in. But you're going to find that people charged with possession of drugs are definitely going to be back out on the street in most cases.
Commissioner Chen, if I could kind of direct that question to you, and what are you hearing these arguments at a state level from all the different counties and the representative bodies that are waging this war front line? Do you hear that in Montpelier, those same set of frustrations?
Well, I think I want to actually put a counterpoint to what some of the folks have been talking about here is I think public safety is clearly number one important thing to keep in mind in terms of whether people stay in jail or not. But I think there's an opportunity to work on the demand side, which I'll talk about, which is a low-level offender, somebody who's not a public risk, somebody who's screened through a kind of an evidence-based screening technique, and we can decide, hey, this might be a great opportunity to get them into treatment. And say, well, we'll do this instead of even charging you, which is what we're trying to do in the early intervention program, because we know we just don't have enough jail space to put all these people away. In the federal prisons, the same thing. They were releasing people because I think we had to understand that, again, this is a public health crisis, and it's a health crisis for these people as much as anything.
Let's talk about that low-level offender for a minute, if we could. I think that was, in a lot of ways, some of the pushback against some of the depictions of the problem here in the state from the artwork in Rolling Stone magazine issue when they're talking about the Vermonter, your classic Vermonter, possibly having a heroin problem. I'm just interested, again, from all your points of view on that, but again, starting with you, Dr. Chen, since you were talking about this, what about that sort of rendering is unfair, and what about that is accurate in terms of a depiction of the heroin user here in the state of Vermont?
Well, I think you have to understand that the heroin users, by and large, they're addicted. They have a chronic disease. They need their heroin to kind of treat their chronic disease, so to speak, to keep them from going to withdrawal. We also know that there's really very strong evidence that these rapid intervention programs in Chittenden County make a difference. So you have to look at the data, you have to look at the evidence, and if you can put somebody in a program, get them drug treatment, and you can reduce their recidivism rate by half or even more, I think that's a no-brainer in terms of, because it keeps them from that that revolving door we've been talking about. Again, you have to select them carefully, you have to use evidence-based screening techniques, and then you have to have the treatment available for them. And if it's not available, then you've lost that opportunity.
Right. Lieutenant Merrigan, I kind of want to follow up and ask you a similar question. When we're talking about the people that you're seeing out there making arrests or talking to families in these situations, I think in bygone years we would be thinking we'd have a very different mental image in our head of what that heroin user looks like, what that low-level offender looks like. And it might not look like your prototypical Vermonter. Have you noticed an evolution in terms of the type of person that you're out there arresting or talking to on the street about these issues?
Well, yes and no. Heroin is a funny drug. When I first started doing drug work in '99, I had never seen a bag of heroin before. I'd never, and I grew up in this town. I went to high school here. We didn't have heroin in this town. In 2002, we could buy 10, 15, 20 bags of heroin at a shot. In 2009, 2009 to 2011, when the pill reformulation of hydrocodone and Oxycontin came through, and that's the process that you can't abuse it, you can't crush it, you can't, it's much more difficult to abuse it and get the same effect. That's when this third wave, and I'm going to answer your question, third wave of this heroin issue that we're dealing with now happened. But throughout that whole time period, it's been everybody from working class guys to lawyers and nurses, and that's still consistent here. What's different now, what's different this time is the youth. There's so many young people using heroin now. That's unprecedented. The levels, of course, are unprecedented. That's a different topic, but the commissioner is right. It's a simple economic issue. If there is demand for it, there is going to be supply for it, and it's easy to supply it. It's easy to get it. If you don't have to be very bright or very connected to find somebody that's going to sell you large quantities. It's the demand is where that's our biggest obstacle, is reducing the demand.
Okay, well, yeah, and that's one of the reasons why we sort of came here. Now, after what happened out on Putney Road, what happened at America's Best Inn, I often get a lot of feedback about, what's going on in this town. How can we lose such control so quickly in this town? This is not Brattleboro, Vermont, and folks like yourself can attest to that. This is not, if you will, the typical New England sleepy little community that just kind of goes about its business with its arts and its craft beers and all that. And now all of a sudden we've got real primetime TV stuff going down here, and it scares people. And it scares people right to their core, and they want to know what to do, which is why we've created this panel of people to kind of give some introspective as to what citizens can do to be involved. Let me address that's a roundabout way of saying, I'll start with you, John Merrigan. What can a citizen do to get involved? I mean, obviously, we don't want any vigilante type stuff. That's dangerous. So, we don't want anybody putting on a red bandana on their head and charging into the front lines. That's your job. So, tell us what they can do.
Well, the first thing that is important to get out there is that is what Brattleboro is like. But it's not just Brattleboro. It's every town in this state. Every sleepy, classic, bucolic town in this state has a heroin problem. And any one of us, I could take myself and anybody here on the panel or in the audience, take $1,000 and go for a ride and buy heroin in a half hour. That's a fact.
Well, that's a scary fact.
But it's a true fact, and anybody in the business won't deny it. It's real and it's here. So just having these discussions and putting it out there is important. Mm-hmm. As a community, and there's no family that is immune, my own included. No family's immune to this. It's it's a horrible, invasive, dividing issue for everybody's family, including my own. What the best thing about everything that's happening now is like taking the scab off a wound. Nobody knows what's there. It's the best thing that we can do is be aware of the people that our loved ones and our friends are hanging out with, and trying to get a sense of, is this really happening? The abuse levels are far higher than your average citizen, your average person would think, and they're probably higher than I think. And this is really the only thing that I know. It's a difficult situation, but being aware, open, honest, and trying to have real conversations with anybody that you think has a problem is a start.
Right, and which is very specifically to the point why I appreciated what Governor Shumlin did to take his State of the State address and hit this thing right between the eyes. Was a really powerful statement where most people like to kind of pull back and just say, oh, no, you can't do that. That's going to hurt our ski industry. All right. Well, I got news for you. What's going to really hurt our ski industry is a huge influx of heroin into our streets. And the other thing that I really appreciated was the Rolling Stone column with a really harsh depiction of a maple syrup can and a guy shooting heroin sitting on a log. I mean, it was pretty powerful. Commissioner Chen, let me just ask you really quick. What was on a state level? I mean, just your own impression when you saw that image. What did you agree with it? Did you have a visceral reaction? Was it no? This is a discussion that needs to happen.
Well, I think that picture. There's no one here that it didn't get your attention, and I think that's really what it was. And if you read through the whole article, I think it was a pretty realistic depiction of the issue. And actually, going back to your question, I think it's really important that people understand what they can do, because everybody can do a little something. So if you have a drug cabinet at home, do you know what's in that drug cabinet? Mm-hmm. Right? Are there drugs there that really shouldn't be there? Because we know that 60% of people get those drugs, their first drugs, from a friend or a family. So they're not buying it on the street. They're getting it from their friends. They're getting it out of a drug cabinet. So if you have controlled substances in your drug cabinet, take advantage of the disposal things, the opportunities available. If you have a kid, start talking to your kid about that stuff. We also know that if you talk to your kid about drugs and alcohol, it actually reduces the likelihood that they're going to get involved with that kind of stuff. So I think it's being a parent, and it's getting together as a community to look at what are those prevention things you can do to both educate people and to work together on the whole issue with law enforcement, with the healthcare community, with the treatment facilities available. And I want to make sure that people know in Brattleboro know that on the 16th of June, the governor is hosting a opiate, a community forum on the response to opiate addiction. And we're inviting community teams, because we understand that we can't solve this all from up here. you're going to have to solve it in Brattleboro and in Rutland and in Bennington. With the help of the state. So we're inviting community teams up for an all-day event to both hear about what's the best practice in terms of prevention, because we really need to focus more on prevention, and also to come back as a group energized to do some work in your community. So the way to get involved is to work through the local health office for the Department of Health, which is just next door here, to get to who will be arranging those teams to come up.
Thank you. Yeah, no, it's very important, and I do want to emphasize what Commissioner Chen just said. This all happens at a very local level. So we can't control what's happening in Essex County, Chittenden County. We can only control right here within our broadcast area, which is Windham County. And if we start there and everybody starts to adapt like what Chittenden County is doing and take that as a leadership role, and then we can all adapt that, then I think we have to come together. But it's a power and numbers thing for sure. And speaking of numbers, we need to take a quick break, and we'll be right back. We are broadcasting live. A call to action from Brooks Memorial Library, downtown Brattleboro, in the meeting room. If you'd like to come up, we will be here till noon. Ask a question. We encourage that. We have a panel member right now consisting of Lieutenant John Merrigan from the Vermont State Police, Tracey Shriver from the State's Attorney's Office, and Commissioner Chen, all the way down from Montpelier. Thank you. We'll be back in a few moments.
Welcome back to the meeting room of Brooks Memorial Library. Chris, Lenois, and Fish hosting this special edition of the live and local program, a forum on heroin addiction and drug-related crime in the Brattleboro area that we're calling a call to action and broadcasting until noon on WKVT 100.3 FM and AM 1490. This is free and open to the public, and you're welcome to come down here and join us, ask questions of the different panelists we've had. We're spending the first hour with Commissioner Harry Chen from the Vermont Department of Health, Tracey Shriver, a Vermont State's Attorney, and Lieutenant John Merrigan of the Vermont State Police. We wanted to open up the floor here for some questions, and I know Bob Ozer is here in the studio, or the meeting room, I guess, more than a studio.
Right. Force of habit.
They don't let me out very much, so got to remember where I am. But this is from the floor. Bob, go ahead.
Yes, thank you for doing this, by the way. This is terrific. Just a brief intro. On alternate Thursdays, I unload 3 pallets of dairy, and I'm doing that this afternoon. So a guy I was working with during unloading the pallets says to me one day, and he had a prior conviction for something, said, "I'm applying to this job and I'm having difficulty getting the job. What do I need to do?" A couple of weeks later, unloading some more dairy, says, "I'm not going to get it. It's got restrictions. I've got the conviction. I don't get that job." I'm not making cause and effect here. I'm telling a story which is very complicated. A couple of weeks later, he don't show up for work. Newspaper report, joint investigation with Brattleboro and Bellows Falls. He's arrested for 150 bags of heroin. All the co-workers not really knowing what was going on, except he did have the smartphone and the throwaway phone, which was a giveaway retrospectively. So there's a question embedded in there, but I want to hold it rhetorically, which is, how do you deal with your friends and co-workers in that kind of situation? I submit also there is an economic basis to this, and I think someone said that recently. Bain Capital, which certainly has an economic basis, recently bought Habit Opco, the methadone clinic in town. A lot of good words in the article on Vermont Digger about it, but bottom line is, if you can make money at that business, what does that mean? So that's a rhetorical question. There's an economic basis to this. One of the reverends locally went to the overflow shelter when it was open, got introduced to some of the guys on the street. Some of the guys on the street were telling her, now this is considered a source, I don't know if it's good info or bad intel, huh? We're telling her that dealers were coming to prey on the patients. Because, hey, you know I sell yogurt? You know? So you don't want to sell yogurt to somebody who's vegan? That's not a good match. So you sell the product where you can sell the product. Last thing with that. Two guys come in. I'm a notary. I was a notary in New York. I had to take a test. In New York, you get a notary. You get your commission before the check clears. Two guys come in to get a statement notarized. I said, fine. You got ID, who we are. He said, well, it's a statement that I'm going to swear that this other fella is heroin addicted or opiate addicted for 2 years. I said, I don't have a problem swearing you to this, but where's your medical capability? He says, oh, that's what the program, Habit Obco, requires us to bring in lieu of a medical. I know that's not the entire story, but the rest of that story is they didn't have a lot of respect for the program. So if you don't have a lot of respect for the program, how do you get the rehabilitation?
Okay.
Thank you.
Bob, thank you,
Thank you.
for all of that information, anecdotes, and certainly I'm interested in hearing our panel's response to any of those points, but also there are people in the audience as well here who might want to respond to different aspects of what Bob just presented, either hypothetically or with specific cases here. I don't know, but let me turn to my panelists first here and see if anybody has any general thoughts. I'm hearing conversation around more compassion during the rehabilitation process. I'm hearing things about giveaways that people can look for in a situation where they might be suspecting use and ways that they can safely tip off law enforcement authorities about this. A lot of things brought up there in Bob's statement. Anybody want to start the ball rolling there? Go ahead, John.
I will. A methadone clinic in and of itself is only as good as the guy that's going in and his intention on what he wants to do with it. If you're there because it's something that you've sold your family on, which happens all the time, or something that you're trying to sell to the court that you're doing a better job, but you're still an addict and you're still in the business, that's a great place to make connections. That's a great place to get better places to go out of state for cheaper heroin. And it is often a marketplace for heroin sales and opiate sales. So just if you've got a loved one in a methadone clinic, that does not mean that they are in the clear. They're not in the clear. They're actually associating with people who may be able to help them continue to get heroin. It's the best game in town. It's not perfect, but it's still worth doing. So that's what I'd have to say about that.
Yeah, please, Commissioner Chen. You.
So there are a couple themes here I want to just kind of both speak to, and one is somewhat what you said. I want it's clear again. When you go to the methadone clinic, you're not cured. Yeah, you're a lifelong. If you're addicted, that's your lifelong disease you have to bear. And so the methadone clinic is important because it takes care of some of the major issues, but you're still going to have to get your life together. You're going to still need the support to find that job, to find some reason for hope. And all those things need to be supported, whether it be at the clinic or in your family or in the recovery centers that are so vital to keeping that link together, keeping that person with that lifelong addiction from going back. So all those things, whether it be reusing or recidivism in terms of the criminal justice system, those are all important things that we build a system to approach this in a comprehensive fashion.
Commissioner Chen, I'm sorry. We'll get to you in a second. I have as I poured through all the data going through it and doing the research, there must be a cost to the state of Vermont once somebody has been labeled addicted and is being pushed through the process, methadone clinics, rehab, or whatever, and if they can't afford it, do we have a number what the cost of a recovery is for a person? And I only ask the question because if sometimes, because we are a very bottom line society, very money driven, if you can attach a number to that might just wake somebody up and just say, okay, so what do I need to do to head that off before that happens? Well,
we do have cost numbers. So we know, for instance, that we spend about $30 million in Vermont for the actual treatment, the drug, the treatment for Vermonters addicted. But we also don't count the other costs, which is we know it actually costs more to put people in jail than it does to treat them in a methadone program. So we also know that we spend a tremendous amount of money in terms of social services, keeping families together, trying to keep kids with special ed in school. So all these things have ramifications down the line that it's really difficult to try to figure out. But we're spending a lot of money in Vermont, both from direct costs related to addiction, but also the indirect costs related to society.
Okay. We do have a question from our audience, if we can just take that. If you would grab the microphone and state your name.
Hi, my name is Vicki, and this question is for actually Commissioner Chen. It's actually kind of going what you were just talking about. I have a family member who is a recovering addict. He's been clean for about a year and a half. However, there's always that chance of relapse. What I had found trying to find programs for them, for my family member, I came across the insurance company, and it was very hard for me to see that a lot of insurance companies will not pay for rehab or for therapy, especially for someone who might have had a criminal background or they were arrested because of drugs and there was some kind of in the insurance plan they wouldn't accept it. So we had to come up with a lot of money to get our family member in a program. My question is, there's any reform out there to help if the insurance companies can help us be a little bit more flexible about rehab and therapy, because 30 days is not enough, and we all know that. Long term is a lot better, and hopefully with long term they won't go back. So just wanted to ask that. Thank you.
Thank you.
So just to respond, I actually had people, I hear that all the time, that 30 days is enough. And so I had to go back and say, well, is 30 days enough? And the answer is 30 days is not enough, but it's not 30 days inpatient. It's not 30 days resident. What we know is that success for treatment from opiates is tied to 90 days of at least 90 days of treatment. And it can be outpatient, it can be residential, it can be intensive outpatient. So rather than, there's no magic number for the residential. So I think it's really important to create a system. And that's what we're trying to do with this, what we'll call the Care Alliance or the Hub and Spoke, a system which works both with methadone clinics, spokes with primary care centers, residential settings, and then finally recovery networks. So all that can give you that 90 days, which is really what's been proven. 90 days of connection of a person to a treatment system in a community is really key. The challenge with the residential is if you don't build that other system where you live, it ain't going to work, because you go right back to where you were before.
Thank you for that answer. One thing I heard both Bob and Vicki ask that I think is important to address here is, even beyond a situation where you've made an arrest, you've gotten somebody some treatment, hopefully they're in the process of recovering, they've escaped the addictive properties of heroin, but then there's that next step of reintegrating them into society, into the community, finding them a job, and not having this crime that they've committed count against them. I'm not sure where in the process an opportunity and making the person aware of the opportunities available to them. We certainly have a lot of great resources in this community. It does strike me, however, that it might be during the sentencing part of the process here. And so I'm looking at you, Ms. Shriver, in terms of how you communicate with the person who is going to have to do time for their crime, going to have to get treatment for their addiction, but also what their opportunities may be after they've served that time.
Well, sir, I think what we're talking about is collateral consequences, and certainly that's something that prosecutors have some opportunity to talk to folks about. Defense attorneys have a lot of opportunity to talk to folks about. And judges, there's movement in the legislature to require judges to talk to defendants about it. What I would do, when I heard Commissioner Chen say and I heard Bob say, brought up about hope, and I see a lack of hope in court almost every day. Watching the movie The Hungry Heart that the governor promoted, I saw a lot of lack of hope. And the counteraction to that, I think, is for folks to get involved and to help volunteer. And directly in answer to your question, the Brattleboro Community Justice Center has something called Circles of Support. Bellows Falls also has a community justice center. One of the things that those organizations do is help folks who are getting out of jail find housing, find jobs, and support them as they re-enter the community. So I would encourage everyone who's interested and concerned about this issue to volunteer in different places, and the community justice centers are one of the great places to go.
All right, thank you. That's really good. I think we have another question from the audience. Sue Avery is with us.
Yes, good morning, and thank you for being here. I'm here actually as a representative of the Narcotics family group. And Narcotics
I'm sorry, Sue. Yeah, thank
has
you.
been in Brattleboro now for 15 years. We'll be celebrating 15 years at the end of June. We meet every Tuesday from 7 until 8:30 p.m. at Brattleboro Memorial Hospital, downstairs in the cafeteria in Meeting Room B. And one of the things that I just want to touch on is that the focus today has been on the addict, talking about the addict, but really the family members are the ones who are in the trenches with the addict. And I can attest to the fact that attending our meetings and making a commitment to attending our meetings on a regular basis, you will learn how to manage your own feelings, and thus you create boundaries around your emotional response to the addict. I do have some information up here, and I'd be glad to share a little more with others.
Thank you, Sue. Yeah, we do, just so you know, I mean, this is just one part of the panel today, so we will hopefully cover all of those things. But, well, Lieutenant Merrigan was twitching in his seat there, so he had something to say.
Oh, that's great. I mean, it's so important. That culture or subculture is such a, if you're not in it and you haven't experienced it, it's very difficult to understand what it's like. It's very difficult to understand what your loved one's really telling you, or what things that they're doing, what they really mean. And if you don't have experience with it, frankly, it's really easy to get buffaloed. And we've all been buffaloed before. One of the last things I wanted to say, if there's time,
sure,
is we were talking about what can we do as a community, what things can people do to help people that we think is in trouble. And it's easy to say, well, just get involved, get really involved, but that doesn't really mean anything. What you got to do is get involved in a sense, like learn, educate yourself on what it looks like. What does this look like? What does the actual paraphernalia look like? Spoons, needles, snorting straws. What does that stuff look like? You can go online and see it for days and days and days. So if you think you've got a problem, do that. Find out what this stuff looks like. If you've got somebody that you have access to their phone, and I'm not saying this is a legal thing to do, but we've done it in my house. When I had a 14-year-old girl, I looked at her texts. These texts are diaries, and if all these kids are hearing this right now, that's fine too. If you really think somebody has a drug problem, man, you owe it to get in there and look and see.
Chris,
and if you think they do have a drug problem, or you think they are associating with somebody, talk to their friends. Their friends will tell you. It's different than it used to be back when I was a kid. Their friends who care about them will tell you, John is a mess. John's a mess. You should look out for this. And you'll know. And once you have that information, excuse me, what did I write down here?
I have the same problem.
Yeah, right.
Like you and I write with the same hand.
Yeah, if you really do think that you have a problem, get with somebody from Narcotics. Get with somebody that's been through this before, so you can really educate yourself on what this is going to look like when you confront this person, because they're going to say the same things, and it's so believable.
All right. Well, no, we thank you. And so get involved, even though it may be the most uncomfortable thing you've ever done.
It's awful.
We've only got a few more minutes left. Commissioner Chen, do you have any? Do you have like 30 seconds of a parting shot? Something that we really need to focus on here to kick this problem?
So Chris and fish.
Yes.
There aren't many people I've ever called fish, so I want to be able to.
Glad I could help.
Yeah.
Then I'll keep you smiling all the way home today.
Absolutely.
All right.
But I think that, first of all, thank you for doing this, because this is really a beginning of a conversation. It has to be a community conversation, because the solutions are really going to be in this community. It's going to be in your neighbors, with your family, with the local law enforcement, with your healthcare providers. I mean, all of those together is what it's going to take to address this problem. And certainly, I appreciate it's been a pleasure working for the governor and putting his focus on it. We got a long way to go, but I'm optimistic based on what I see going around the state, that we're all starting to put a little more sharper focus on the issue. So thank you.
All right, thank you. Tracey, Shriver, do you have quick 30-second parting shot?
Very briefly, yeah. I would like to thank you both also for inviting me here, and I would echo what Commissioner Chen says. Get involved. I see about, 20 people in here. How many did we have at the budget meeting about the town? We had 100. So the more you're involved, the more you can go, the more you can talk about this issue, put it in the limelight like the governor did.
Thank you all very much. We have to take a quick break. We will be back, and when we return, we will have Reiske here, Dr. Todd Kammerzelt from the Brattleboro Retreat, and Brattleboro Police Chief Jean Wrinn. Thank you for being part of our panel today. Welcome back. We are broadcasting live this afternoon from Brooks Memorial Library. It's called a Call to Action, and it's basically an open forum for the community to discuss the opiate addiction, the heroin addiction, and the crime that has plagued Brattleboro in recent months. And I guess it has really sort of come to light more recently than ever with the governor's State of the State address and, of course, the Rolling Stone articles that have come out and have depicted Vermont, our sleepy little community, in a different light. Joining our panel for the second hour, we have Robin Reiske. Thank you for coming on. Dr. Todd Kammerzelt from the Brattleboro Retreat, and Police Chief Jean Wrinn. And we'll start our discussion.
Yeah, it's great to have three local voices on the panel here for the second hour. Certainly everybody here in the community and dealing with this issue in the community. Maybe I'd like to start with you, Dr. Kammerzelt, just in terms of talking about your unit at the retreat and your role in this conversation, please.
Sure. Thanks, Fish and Chris, for inviting me to be a part of this important conversation. Briefly, I'm Dr. Todd Kammerzelt. I'm an addiction psychiatrist at the Brattleboro Retreat, and I'm the medical director of the co-occurring or dual diagnosis unit, inpatient unit at the retreat. And so what that means is I work with folks who struggle with addiction or abuse issues and the fairly common co-occurring mental health issues that go along, either get initiated or perpetuated with ongoing use. And that can be things like depression, anxiety, PTSD, bipolar, schizophrenia, eating disorders, things that place you at a higher risk for developing a substance use disorder. Once it gets started, the addiction gets perpetuated, and they seem to be this cycle that's hard to break and get treatment.
Right. Thank you. Robin Reiske, I'd like to ask you to do the same and talk a little bit about your role in this conversation as well, because you and Dr. Kammerzelt are definitely coming at this from a different perspective than our first set of panelists.
Sure. So my name is Robin Reiske, and I'm a certified prevention consultant with the Department of Health. And the work that I do is mostly around prevention and working with community organizations to delay the early onset of substances. So when we talk about opiate misuse and prescription misuse, we look at the broad spectrum of preventing all substances, of that early onset of all substances, and doing a community mobilization approach. So we're very comprehensive, and we have partners throughout the county that have been doing a lot of really good work around particularly prescription drug misuse, and we have a lot actually that's going on that's great, and some good news about that in terms of our data. So my perspective is more looking at how do we prevent this.
Mm-hmm. Thank you. And Chief Wrinn, having you here on the panel, I don't think really in any way is redundant to having Lieutenant Merrigan from the State Police. I think in a lot of these situations you want to talk about how different law enforcement agencies work together to combat a problem like this, especially when you talk about Brattleboro as a town. Some people may think it's a big town, some people may think it's a small town, but one thing I think we'd all agree on is that the police department has a lot of responsibilities and not a lot of resources to address those. If we could begin this conversation by talking a little bit about Brattleboro and how the problem has evolved over your tenure as chief, and even before, just as part of the Brattleboro Police Department. I was just telling you off, Mike, growing up here in this community, it was kind of known that I-91 had created this highway of drug passing through southern Vermont. When did it really start becoming a stop and a place where people were setting up shop and dealing?
Well, again, thanks for putting this together, and I'd like to see the crowd here. I'll tell you, I've been here for a little bit over 28 years, and what we've seen over the years is we used to deal with a lot of marijuana, cocaine, crack, and we're seeing a change now to the heroin and other drugs, including synthetics. And what we've been hearing anecdotally is, why should someone from here drive down, pick it up, and bring it back when the dealers themselves can just bring it here and save the middleman, save the money, make the money? So we're starting to fight that. We're the largest population in the southeast corner of Vermont. We have 3 exits off the interstate, along with the Route 9 and Route 30. So we've got some major roads that come in and out of town. It's easy access, easy in and out of town. So we're finding that problem, and we're dealing with that.
Can you talk a little bit about how you would interact with Lieutenant Merrigan's task force or other law enforcement agencies? I mean, certainly there's even an opportunity on other levels maybe for a federal agency to come in here and be involved in something. How does that all work on just a logistical level?
Right. Over the years, we've worked hand in hand with the Southern Vermont Drug Task Force, which Lieutenant Merrigan was part of, and along with other agencies. The Drug Enforcement Agency has done a lot of work in town. So from time to time, what they do is they come in when they recognize a problem or a trend, and they'll dedicate some extra resources for it. The Brattleboro Police Department is a 28-man department or 28-officer department, 24/7 full-time service. So we're responding to all types of calls while trying to proactively investigate these crimes of illicit drugs.
Mm-hmm.
So we sometimes don't have enough staffing to do that, so we'll reach out for other agencies for assistance, and they've been very willingly to do that.
Yeah, well, that's nice to have since, again, like you said, talking about the resources you have at your disposal just as a municipal police department versus what you might be able to access from state and other agencies. Wanted to just read a quote that our Congressman Peter Welch recently gave during a congressional committee hearing on opiate abuse in the country, and wanted to start with you, Chief, but then get everybody's response to this, because I think it speaks to the changing way we're handling this problem, and I think it brings all of your roles into the conversation. But he was speaking specifically about Governor Shumlin's State of the State and conversations the governor had with police chiefs in St. Albans and Rutland, and talking about how they were on the streets dealing with kids that they knew. In terms of who they were arresting, who they were talking to about heroin use in those communities. It was also adults they knew who had jobs, but who also had this horrible addiction. And what the police kept saying to the governor, these people who had frontline responsibilities, is you cannot arrest your way out of this. And I think that really that comment speaks a lot to how we're changing to address that problem. And I'd like to start with you, Chief Wrinn, in terms of talking about how you work with your officers to understand that change, not just arresting your way out of it, but making sure that at the same time you're arresting somebody for committing the crime, that you're also trying to take care of that individual as somebody who, as Dr. Chen was calling them, a low-level felon.
I think that's 100% accurate. I think people understand we are not going to arrest our way out of it. What the arrest does allow is that it allows for a person to get put into the system and get the aid, the help, and the services that they need. The police department has a full-time or a mental health social worker on staff that assists us with assisting these people. But what we need to do is the police department now is working with other partnerships, the Retreat, HCRS, all these other agencies to get the people the treatment they need. But sometimes it's a matter of they need to get arrested, need to get into the system, and need to be ordered to have the treatment they need.
Yeah, and let me throw that to Dr. Kammerzelt for a second with a quote directly from Governor Shumlin's State of the State address following up on this too, and that research tells us that an addict is most accepting of treatment right after the bust. It's when the blue lights are flashing and the cold reality sets in that we have our best shot. So that handoff from the police, from the authorities, to somebody like yourself, to somebody on the treatment side, I think is really the most crucial time.
Yeah, I think that, going back to the first point that you had made with Senator Welch, I think it was, who said you can't arrest your way out. And that's, kind of abundantly clear. It's been, I think, 42 years since the war on drugs has been declared. And it's only the first year that was initiated, there was more money spent on treatment and intervention. And every year since then, the vast majority, over 90% of the dollars, have been spent on interdiction, incarceration, and the judicial process. And so there's a finite amount of money out there, right? And so we all want more of what we do. So I want more availability for folks to receive access to treatment and care. The police departments want more money to be able to community safe. Citizens want their communities to be safe. They also want their family members to be in treatment. They want people to not develop the disease or to become addicted in the first place. So they want more resources allocated to prevention. And that's why the three of us are all here. The challenge that we have in this country is, in part, once people, and this is starting to change, and some of the panelists in the last hour talked about it, but part of the challenge is once you have a felony on your record or criminal charges, it makes it harder to obtain a job, develop wealth, and begin to kind of start over and start your rehabilitation and start at an even place to move forward. I'm excited to hear that when people see the blue lights and they're caught, so to speak, that they're very I believe they're very motivated for change at that time. Now, whether a week later they're still as motivated, it probably depends on what intervention has been done in the interim. Are they actively engaged in services? Are they waiting in a cell? Or are they returned to their home and back to their comfortable position and subject to those same stressors and influences that led them down the road? The other important part is the disease of addiction, once it begins, is a chronic illness. It's not something that people choose, but once it gets started, it's not an on-off switch.
I think I would agree with you. I don't think anybody grows up and wants to be addicted to an opiate, addicted to heroin. So inherently, I believe the first steps into life want to be good and pure. They want to be a policeman. They want to be a fire chief. They want to be a rock and roll star, which goes to the contrary of what I just said. I apologize. But there is that. And that moment, that impactful moment when you find yourself in the back of a police cruiser and Chief Wrinn and his men are doing his job, Lieutenant John Merrigan and his men are doing their job, there is that impact where you would do anything to make that feeling stop, anything at all. And if that means submitting to an addiction program, will be great. But then a week later, and I had this conversation with a woman who had 7 children, who said the reason they keep having 7 children, keep having children, is because they forget the pain of childbirth. And they have another one. So it's just because if you could retain the pain of childbirth, my guess is that the planet would have ceased to exist a long time ago. So on that point, though, Robin, I'd like to bring you into the conversation, not on childbirth, but on where there might be a little breakdown maybe between there. Do you see anything like that happening, like a breakdown between bust to like further prevention and rehabilitation?
Yes, and one of the things, going back to the quote about, we can't arrest our way out of it, at a recent Hungry Heart event, Lieutenant Craig Laporte said, we can't treat our way out of this problem either. And what I felt that spoke to was that we have to be comprehensive. And there were even people on the panel who have been in trouble with substances who said, had I not been arrested, I wouldn't be where I am today, which is clean and sober. And so I think in the work that we do in prevention, it's also very comprehensive, and we look at the person, the individual, from a lot of different perspectives. And one of them is that we are delaying that early onset of a disease process, and that we know so much more about brain development and how that early use of any substance, it could be tobacco, alcohol, marijuana, can impact that developing brain. It can develop how somebody copes with emotional or social situations. And so when someone goes into recovery and they put down their drug of choice, the hard part is not picking it back up and falling back into those behaviors. So it's more than just giving them another substance to take. It's about changing their environment, their friends that they hang out with, how they socialize, how they connect with other people. It's all part of the recovery process, and the role that prevention plays in that is basically relapse prevention and getting them support. And so, as was mentioned earlier by Susan, it's an ongoing process. It's not just, well, I'm going to stop today and I'm not going to pick up again. It's a lifelong recovery process, and we need to make sure we have a lot of support for people who are at that stage.
Thank you. All right, we do have to take another pesky commercial break, and we'll do that. And when we come back, what I'd like to do is kind of get into the nitty-gritty street level of some of this stuff. So we're going to hear from Kate O'Connor, who's going to represent us on a select board level and on a Main Street level. And we want to find out what's going on Main Street, and then we'll bring Chief Wrinn in and right down the line, and we'll have that conversation. We want to thank our current panel, Robin Reiske, Dr. Todd Kammerzelt, and Chief Wrinn for coming on in the 10 o'clock hour. And we'll be back shortly right after this moment. You're listening to A Call to Action on 100.3 FM and AM 1490. Welcome back to A Call to Action. We're broadcasting live today from Brooks Memorial Library in the meeting room, and it is open to the public. If you have a question regarding opiate addiction, heroin addiction, questions on how to head it off at the pass, today's the day to get yourself down to Brooks Memorial Library. Right now, our main panel is Robin Reiske, Dr. Todd Kammerzelt, and Chief Wrinn. But Kate O'Connor was good enough to join us because we wanted sort of a voice from Main Street that's representative from Main Street and also our very own select board. So we thought it would be good. Kate, can you tell us what the general merchants, and please stand up, with general merchants and what the feeling is on Main Street around the reoccurring problem that we seem to be having?
Yeah, sure. I think all of us know in this town, anybody who's gone downtown, that we have a wonderful downtown and we have a lot of great businesses. But obviously, having a drug problem in downtown doesn't help our image. And, I was just talking to somebody here. You're almost afraid to go downtown, especially, after it gets dark, which isn't helpful to us. Mm-hmm. And I think, after the governor gave his speech and it became a national issue in the New York Times and, Rolling Stone, there was obviously some concern that we were getting bad publicity. But I think people are grateful that publicity leads to action like here today. So it's sort of maybe counterintuitive, but you're only going to solve the problem if people actually speak about it openly. So it is a concern downtown.
Okay. And on a select board level, how much does it come into a meeting, during a select board meeting, that those concerns specifically? Actually,
I'll be really honest with you. People haven't been coming to the select board meetings to talk to us about it. And I don't know if it's because, we're sort of engulfed in a budget situation now. But I know, as the Chief Wrinn said, they deal with it on a daily basis. Mm-hmm. But it's been surprising to me that there hasn't been more people just at least coming to public participation at select board meetings to talk about it. Well, I'm actually shocked to hear that as well, because it seems to be on the forefront of everybody's mind. And I think would that be a good forum for local movement as far as getting something started that will help Chief Wrinn out, that will pull in Robin Reiske and the Brattleboro Area Prevention Coalition to help them kind of all work together to educate? Would that be a good place to start, do you feel? Sure. I mean, I think it's always good when the public comes and expresses their concerns. Because we haven't talked about it on a select board level, I really don't know, what we can do, but that would start us trying to figure out what we can do. Exactly. And I know the police department is working a lot on this, and I think we as a town should be thankful that we have a great police department. We do. We definitely do.
Ms. O'Connor, I'd like to ask you and Chief Wrinn, and maybe you can both talk about this from your perspective, but how the business owners and the law enforcement agencies do interact. I mean, are there opportunities for you to have lines of communication other than just calling the police because you're suspicious of somebody loitering or somebody's acting funny in a different way, or you're seeing illicit activity? What are some of those day-to-day, and maybe this is something, Robin, too, where the Prevention Coalition comes in, but I'm interested to hear what mechanisms are already in place for that sort of communication to happen.
Yeah. Well, I can say that there's, I'm located down at the Chamber, which is right on the corner of High and Main, mm-hmm. and I see police officers just walking around downtown, making themselves known to the merchants, which I think is important, that there can be an open conversation. Just the other day, the police department held I think it was called Coffee with Cops. And I think, just having a police presence and having the business owners feel that they can talk to the police is a really good step. That I think it's been going on for a while now, but if you feel comfortable talking to a police officer, I think the police encourage that, participation as well.
Yeah. Let me ask you, Chief Wrinn, how you process that information that you're hearing from business owners. Certainly, I think any of us who shop downtown, who have been downtown at any time of day, we can all think of certain locations in town that could be classified as hot spots for illicit activity. How do you communicate that sort of information within your department and then try and take some actions there?
Right. For the past number of years, what we've had is 1 hour of every officer's shift time is dedicated to walking on foot downtown, to be highly visible, to interact with the shopkeepers and see what the vibe is and what's going on and where they need to focus their efforts. For a number of years, the sergeants have been working on a project. Each shift has a sergeant assigned. They've been working on data collection to find out where there's a hot spot, where there's crimes going on, and where they should focus our resources. We spend a lot of time on a daily basis investigating crimes against persons, thefts from motor vehicles, burglaries, things of that nature that really affect people. And what we found is a lot of these crimes are committed solely to steal property, to sell, to get money to buy drugs, either buy drugs or trade for drugs. So these affect everybody. What we want to do is be able to focus our resources targetedly to stop those things. We need to find out. Lieutenant Perkins, who works the midnight shift, has been working with Norwich University looking at data for the past few years to try to come up with a mapping system to see exactly where the crimes are happening so we can do that more effectively. But we do spend a lot of time downtown.
Great. And Robin, from the prevention aspect of things, I'm sure it would be nice to think that we could get ahead of this problem, and there's certainly a role that you can play there in terms of communicating with business owners and communicating with people on the streets in these scenarios as well.
Yes, absolutely. And we are very fortunate in Windham County that we have 5 prevention coalitions that are working on a lot of strategies that involve everything from, when we do prevention, it's a little different than treatment. We're able to take a step back and look proactively at what are the risk and protective factors that are leading to these problems. So we know that availability of substances are a huge piece. Social access to any of these substances, we have to reduce that. So we do a lot of work around safe disposal and safe storage of prescription drugs. We have campaigns throughout the county, Lock Your Meds. We have brochures that we hand out to pharmacists to give to their patients as they come in about proper storage and safe disposal. We also do work with physicians around retail access. We need to educate our pharmacists and doctors about prescribing practices, talking to their patients about the side effect of addiction. We're handing out these narcotics because we don't want to see patients in pain, and yet we don't talk to them about these potential problems that can arise. We have some of the best prescription monitoring systems in place throughout the state. We actually, Vermont ranks #1 for Robert Wood Johnson has policies that states can take into account, and we have all 10 of these policies in place in terms of law enforcement and monitoring practices. We also have WindhamRx.org, which is a website that you can go to get information about all of our drop boxes. We have 5 permanent drop boxes in the community of Windham County, and we also promote the DEA Take Back Day. The other thing is that we also do a lot of education about perception of harm. A lot of people think, well, the doctor gave it to me, therefore this is a safe substance. And we also give a lot of information about the prevalence data. One of the things that happens is that when we call something an epidemic and we think everyone is using, we set a social norm, and we actually will see use increase. It's very important that we frame this issue as accurately as possible in prevention. For example, we know that less than 1% of Vermonters are engaged with heroin, but we don't know that when we see that it's an epidemic. Calling it endemic may be more accurate. Endemic implies that a small population have stabilized their use over a long period of time, and yet we know from talking to law enforcement and treatment providers that even though it's a small population, it has a huge impact on our community. And so delaying the early onset of all substances, alcohol, tobacco, marijuana included, will help decrease these other issues. And the way that the town can get involved is, for example, our coalitions go to the select boards and talk about setting better standards for when somebody comes in for a liquor license, or making parks smoke-free, or doing all of these things add up to delaying other drug use. We can't look at opiates isolated. we have to take it all into consideration. If you go see The Hungry Heart, it's a great, powerful film, but don't walk out thinking, well, thank God my kid is only using alcohol or marijuana, and it's not going to be a problem. We have to continue to look at this in a comprehensive manner. So we are actually, we're blessed actually in prevention that we can take a step back and proactively look at this in a comprehensive manner, and that we're not in a crisis mode with it, but there are definitely ways that the town can get involved, promoting things like our FEET neighborhood, which is the Frost M. Elliott Triangle. It's a community that struggles, that is really working to create connections. How could the select board support that neighborhood? Looking at how to get more funding for prevention and all the work that we're doing. And we collaborate with treatment providers, law enforcement, businesses, parents, youth, all of these things are very important. So I think there's a lot that is happening that's positive. Our youth risk behavior survey, most recent survey, shows that all of our drugs of abuse are down in Vermont. The only ones that have not gone down are marijuana and stimulants, but we are making progress. We have not seen a spike in heroin use in this country since 2003, and I think that we're just showing that it's here and we're addressing it in a different way. And thank goodness for our treatment programs and the hub and spoke and methadone programs that are reaching people in need.
Thank you. Dr. Kammerzelt, let me ask you how much this conversation about the social impact of drug use is focused on in treatment in facilities like the Brattleboro Retreat. I think most people think about recovery treatment as a very inward journey, but is there a place in there to talk to the person as they're going through their battle with addiction, to make them aware of all these concentric circles of impact that they're having negatively on a community?
Yeah, Chris, I think that's really important. And there's different phases that people are in treatment. Working on the inpatient unit, I work with folks who are acutely and early in recovery. And so what that means is really working to assess them fully based on the substances they're using, addressing untreated mental health issues that often co-occur. 80% of folks that I work with who struggle with addictive disease also have mental health disease as well that is often untreated. And as I said earlier, that kind of perpetuates the cycle. You can't treat one in the absence of addressing the other. So once they're kind of medically stable and safe, and there's a few substances where people start to withdraw from, and there can be life-threatening complications if they're not addressed early on. After that is stabilized, and whether that's still in an inpatient setting, residential, intensive outpatient, partial, or individual counseling or peer-supported recovery, a person is more in a situation to start looking at all of the ramifications of their use. We often try and include, if the patient wishes, family members who, if they allow family members to come in and have a conversation about what to do next, how to move forward, and how to educate the other people affected by their use. Because the disease, although it feels very lonely and isolative to the person afflicted with it, it has this tremendous wrecking ball activity for everyone around them, and it affects most greatly those they're closest to, so proximate family members. It certainly has its effects on schools, employers, but the real kind of damage and misunderstanding often happens with people they're closest with.
As I, again, doing my research, trying to get myself prepared for this, one of the things that I learned that I didn't know, and you would think that I would have somewhere picked this up, is, first of all, I mean, heroin's the big buzzword because it's just a real dark cloud, and when I was growing up, if somebody was on heroin, something really, really, really went wrong in their life. If they could stick a needle in their arm and shoot this drug into themselves, something horribly wrong went, and you were, forgive me for saying this, but it was, all right, collateral damage. One gone, that's okay. So you just sort of accepted that. And now that thinking has changed, rightfully so, but we should point out that this really, in large part, starts with the opiates and how much in any given point in time is prescribed at one point in time, 90, 100 pills. in grandma's medicine chest. I mean, how does grandma keep track of that? And that's kind of where it goes. And it goes back to speaking to the work that the Brattleboro Area Prevention Coalition does, that Robin does, and that I'm sure Chief Wrinn is seeing on a daily basis, where it's not so much the problem is getting younger. It's sustaining, but it seems to be getting younger. And maybe laws that, I don't know how you do this, because I know that insurance companies dictate a lot of what we do. And a lot of what you do, Dr. Kammerzelt, and how much you're allowed to help based on, I mean, it costs money to bring these treatments to light. I mean, we know that some of the things that Chief Wrinn and his men see on a local basis, they are becoming, if you will, the first-line responders for somebody with a mental illness, because those budgets have been cut. So, and that's not a good that's not a good source. Excuse me, that is not a good resource for him to have at his disposal. His guys can't handle everybody with a mental illness just because it's a mental illness. But if you could, I mean, what can change to maybe only prescribe 30 pills at a time? Is that realistic? I mean, speak to that if you don't mind.
Sure. Yeah. No, that's a really interesting point. So there's a lot of areas to intervene, and one of them is physician and medical education. As you spoke, with high quantity, long duration of opiate prescription, and the thinking has changed over time as we've learned more. It was back in the 80s, the medical community thought opiates are fine, they're helping people's pain, they can be on them long term, this isn't going to be an issue. That is a very painful lesson that we're still learning. That's not the case. And with regard to heroin, the surveys that have been done on folks who use heroin or as you say, graduate to heroin from prescription pain medications, 80% of those folks who are using heroin in the past year used prescription pain medication. So it substantiates this notion that folks aren't going out, picking up a needle and saying, I want to use heroin because I want to use heroin. They often start at an early age, when the brain is still developing and most vulnerable to changes and changes in wiring and organization of reward pattern. It's not uncommon, but it is more common that I meet folks on inpatient who come to treatment who started whatever the substance was in their teenage years, when the brain is still early in development and subject to a lot of change and influence. It's not to say that I don't see folks in middle age come in and say, I've been on this pain medication for 10 years because of my back. My doctor keeps giving me refills, and we've tried surgery. We've tried 2 or 3 surgeries. It hasn't worked, and now I can't get off it. But they think I have a problem, and so they cut me off. I didn't know what to do. I get it from the street for a while, and then heroin is a heck of a lot cheaper and more available than prescription pain medications, oftentimes on the street. And depending on where you live, heroin is dirt cheap. So
we've had some folks waiting very patiently in the audience to ask some questions here. We are a little bit past the break, so I think we're going to take it here and then use the last segment here during this hour with our panelists, Dr. Todd Kammerzelt from the Brattleboro Retreat, Chief Gene Wrinn from the Brattleboro Police Department, and Robin Reiske from the Vermont Department of Health, to open it up to some audience questions. We're live from Brooks Memorial Library's meeting room, bringing you a forum on heroin addiction and drug-related crime. It's called The Call to Action. Fish and myself, Chris Lenois, co-moderating the panel on WKVT 100.3 FM and AM 1490. We'll be back right after this.
Welcome back to A Call to Action. We're broadcasting live today from Brooks Memorial Library in the meeting room. This is an open forum, open to the public. Our current panelists are Robin Reiske from the Vermont Department of Health, Dr. Todd Kammerzelt from the Brattleboro Retreat, and Brattleboro Police Chief Gene Wrinn is here. We're going to go right to the audience. Julie Davenson from Youth Services. She's the Executive Director. You have a question.
Yes, I do. I wanted to know, get a little deeper into why do people use, particularly around youth. We've talked about some of the reasons, but when a youth opens that medicine cabinet, they have a choice to take that. And what are some of the reasons that you're seeing why youth are choosing to use, and what we can be doing both as parents, educators, in a community to help prevent that?
All right. You know what? It would be really interesting because I'm sure that we probably have two answers that are going to be similar and one answer that might be a little different. So I'd like to direct that right out of the gate to Chief Wrinn and what you find that you're hearing back as to what the reasons are.
I think some of the reasons may be pure peer pressure, inconvenience, and opportunity. And those things can be limited and taken away.
All right. That's kind of what I expected to hear. Robin.
I also think that there's natural curiosity and risk taking that happens in adolescence, and part of our work is to provide safer options than doing substances. Also, we live in a culture that believes that everything can be solved with a pill or in the moment. We are only one of 2 first world countries that allow direct-to-consumer marketing of pharmaceuticals, and we have a norm in our culture that all you have to do is take a pill and everything's going to be okay. And I think that one thing we can do with young people is to help provide meaningful contributions for them in our community and let them know that they matter and that they don't have to take risks by harming themselves, and continue to educate them on the dangers, and also changing some policies. We need to get a handle on this social norm that there's a quick fix to everything.
All right, great. Dr. Kammerzelt.
Yeah, I think when you look at youth, and again, I'll get back to this notion of the developing brain. So kids aren't just small adults. They don't have the same kind of frontal lobe or executive function. And when I say that, I mean, we have kind of 2 parts to our brain. There's this mammalian brain that is reinforced with excitement, pleasure, and then there's our frontal brain that says, actually, don't take Robin's pen, even if you want her pen, right? And usually I have my executive function is intact, and I don't do that. With kids, their wiring is still developing. They don't have necessarily a lot of downstream thoughts about consequences and risks. So part of it's they're immature brains, and if you, I don't yet have a teenager, but I will before long, and I'm terrified of that notion. But when she gets there, I know there's going to be a whole lot of influences that are out of my control driving her to make decisions. And so whether I need to model good behavior or explain risks, and the other thing is keep her busy. Because when kids aren't busy, that's when they start to be at high risk for exploring other more exciting things that can be really dangerous for them down the road.
I think those are all really good points. Beth Shrader has a question.
This is Beth Shrader from the Brattleboro Prevention Coalition. Recently, we held a community conversation on preventing teen misuse of prescription drugs, and there were a couple of things that came out of it that I think the community can learn from. And one is that, believe it or not, this community conversation was moderated by teenagers, and they were a part of it. Fish was there, and there were lots of adults and lots of youth there. So youth are concerned about this, and I think that we can't dismiss them as being part of the conversation. They have to be part of the conversation. They are under tremendous amount of stress in their day-to-day lives, and it's easy, as Robin said, to medicate that with a pill. Instead, we have to teach them how to manage their stress, whether it's yoga, meditation, or some physical activity like a sport, keeping them busy, as Todd said. I think that we're going to use the model that we did with this community conversation and bring young people, young adults and youth together with adults to kind of come up with this task force or working group to come together to address that issue. And I invite anybody who's interested in being part of that prevention conversation to call our offices at 257-2175 and be part of that. Because I think, as Julie said, one of the things that we need to do is what's the social issues? Why are kids using? And besides the social norm, it's engaging them in that conversation and making them part of the solution, and learning from them and having them have a voice in this, which Youth Services is great at doing and a lot of other organizations are. And I think that's what my call to action is: get involved with this conversation and be part of the solution with the young people that you're concerned about. And it seems to be something that keeps echoing throughout today is it really what it takes is personal involvement, some personal accountability as a parent,
first and foremost, and just to maybe, I think Lieutenant John Merrigan had suggested literally looking at your kids' text messages and seeing what's in there, even though that might seem like every single kind of a violation that you could imagine, and that the comfort level in doing so might just be off the charts. Would you agree, Chief Wrinn, that's pretty critical?
I would agree. It is critical to understand and know what's going on. We have a dedicated group of men and women for the police department that work every day trying to deal with this drug problem. We're not going to solve it by ourselves. What we really need to do is people to be the eyes and ears. If you see something, call us. Let us know. If we don't get that call, we can't do anything about it.
All right. So let me address that really quickly. And I know we have another question coming in, but so I recently had the occasion to have this conversation, and I said, so just call. Make a call. I sat in Gene Wrinn's office the other day, and he said just to call. So they called, and they said, the first thing they asked me is my name and my number. And I said, well, just tell them that you'd like to make an anonymous tip then. Well, why do they do that? Well, probably because it's an emergency phone line you're calling, and then if you get disconnected, they need to know who you are.
Right. The Brattleboro Police Department also has an anonymous tips hotline.
Okay.
251-8188, 251-8188. And you can call and leave an anonymous tip. It makes it much harder for us to vet that out and see what we need to do to investigate it, but at least it's some information that we have. It's one point of reference that we have. If we talk to you in person, we can ask you some follow-up questions. Even if you don't want to get involved, we can at least follow up with that. But
Okay.
it's better to talk to someone in person.
Thank you. Now, did we have
We do have another question over
Could
here.
you stand up, sir, and give us your name?
Hi, I'm Jesse De La Rosa, and coming from a background in pain management, I just want to reiterate what both Beth and Robin have said and ask for you to assemble the resources as next steps on the radio program, just like you do the downloads.
All right.
Whatever that's called.
Podcasting.
Podcasting, yes.
This will all be podcasted when we are done.
But in addition, drawing attention to the fact that we do already have so many resources that need to be built and also overcome the silo syndrome in our town, where, like Robin's working in a community called FEET, as she mentioned, but that could use a lot more participation. And a key word for me is vulnerability. And when you were asking for causes, it seems to me that in addition to the infrastructure of socioeconomic distress, what's causing stress is also the fact that community needs to step in and fill the void of what the future and anxiety of the future can provide in Brattleboro. So that if we are really assembling and knitting together the kind of resources that we're calling for today, that it would be all the more not only constructive, but strong and resilient.
Yeah, I thank you for that comment, and absolutely, this is not the end of the conversation in any way, shape, or form.
No,
so
this
we'll continue
this
that.
is an ongoing commitment that we have here.
Yeah.
We've got roughly about 2 minutes left. I know that Danielle Southwell, who is with Youth Services, has a question for Dr. Kammerzelt.
Yes, I'm just curious if you can talk about your opinion of buprenorphine and methadone as treatment options.
Sure. That's a question that comes up a lot, and people have really strong opinions about those medications. And my sense is they can be an important part of recovery for people. The most common criticism that I hear is you're substituting one addiction for another, and I get why people say that. I disagree strongly, and I disagree because addiction is more than just using a substance. It's the behavior that goes along, the damage that goes along with use. If you're on a pain medication, using it appropriately, getting pain relief, and I suddenly stop that medicine, you're going to have withdrawal. You've been on it for any period of time. That's not addiction. That's physical dependence, and there's nothing pathological about that. It's a process that your body habituates to. The Suboxone, Subutex, methadone, buprenorphine allow people to engage in their recovery without having active withdrawal symptoms, without having strong cravings or urges. It doesn't obliterate them. That's not what it's supposed to do. It's meant to allow you to then focus on the other parts that are key to recovery, the other behavior patterns, the repairing of relationships, returning to work, school, re-engagement with family. So it's not a solution in and of itself. For some people, it can be a part of their recovery, and it can be a very important part. Oftentimes, people get really focused on it, both family members and community and the patient, and inappropriately emphasize its value.
All right, thank you. We only have about 30 seconds left. Robin, if you could put out one message that would help the problem and help cut it off, what would that message be?
I would say delay the early onset of all substances, and that would be the best prevention thing you can do.
Great. Chief Wrinn, same question.
If you see something, report it.
Thank you. All right, we're going to turn it back to the studio. We're running a little over the top of the hour. When we come back, we'll have another full panel. We'll introduce them right after. You're listening to a Call to Action live from Brooks Memorial Library in the meeting room downtown Brattleboro on 100.3 FM and AM 1490 WKVT. All right, welcome back. It's a Call to Action, broadcasting live from Brattleboro Memorial Hospital. Excuse me, we're going to have some people on from Brattleboro Memorial Hospital, and it's a Call to Action from Brooks Memorial Library here at the meeting room. We're broadcasting live on AM 1490 and 100.3 FM. And our panelists, well, we have a full list of panelists. Steve Gordon is on the end from Brattleboro Memorial Hospital. We have Danielle Southwell from Youth Services, Bainca Berry from Youth Services, and Jeannette White, who is a Windham County Senator. Right, Jeannette?
Yes.
Okay.
And serves on the Judiciary Committee.
Right. So this is going to be part 3 of our conversation today. So let's get it started. I know that Steve is on a bit of a tight schedule. So why don't we start with him?
Yeah, and Steve, just to set the stage as to why we invited somebody from Brattleboro Memorial Hospital today to take part in this conversation. Certainly, the role of the hospital has changed when it comes to taking care of the community, and almost in a situation like this, being a first responder in the community. Certainly, with all the conversation around an emergency department becoming the front door of the hospital, also an area where anybody coming in there, you're not sure what sort of emergency you're going to have to deal with, and some of these emergencies, I'm assuming, are substance abuse related. Talk a little bit about how you're addressing those in the hospital setting.
Sure. Well, I think first I just want to commend you guys for putting this together, because this is a big issue throughout Windham County, throughout Vermont, and throughout the country. To give you some sense of context for the hospital, probably about 10% of our 14,000 emergency visits annually are related to substance abuse and psychiatric cases. And that puts a lot of pressure onto the facility and our staff, which has really the new emergency department has really helped in that, from at least the facility standpoint, to appropriately have the facilities to deal with folks that find themselves in a psychiatric or substance abuse crisis. And we are certainly dealing at the crisis point with folks being admitted. We have created at the hospital with the new emergency department 3 rooms that are regular exam rooms that can be converted to safe rooms, so that we have these movable walls that actually come across all the clinical equipment to keep that room safe for both the patient, but also importantly our own staff. So none of the clinical equipment can be used to harm the patient or the staff. And that's a sad kind of state of affairs, to be very honest with you, that a hospital our size at 14,000 visits, we're a relatively small hospital, we really got to look at how we focus our facilities to meet the needs of those patients, and certainly meet the needs of our staff in terms of safety. That being said, that is what is here in Brattleboro, and that's what we have to deal with. So how do we deal with people in crisis? Well, we have a very, very strong relationship with HCRS, who are responsible for working with the hospital on patient care plans, on transitional plans. And we have an exceptional relationship with the Brattleboro Retreat. The Brattleboro Retreat is by far the #1 referral source outside of the hospital in general for all patients right after Dartmouth for medical reasons. So we're happy that and pleased that the retreat is part of the healthcare community. Otherwise, I think this issue would be very, very difficult for us. And we've had patients actually that have had to stay in the ED for several days, over a week, because of lack of placement. And in the last 6 months, I've had to be on a conference call with our Commissioner of Mental Health talking about very specific patients and with HCRS, saying where can we place those patients in a much better situation. The hospital in an emergency room is not a good situation for those patients. And the longer a patient stays, and think about this, if you were in a room, maybe a television set there for 7 days, that's a problem.
That's a long time.
That is a very long time.
And that,
even though the food is good.
Yeah.
Okay.
Yes, you're a server of it.
But it is a real problem, and though because of our relationship with the other agencies within the community and specifically with the retreat, we have been able to, I think, effectively move patients to a better place and a better transitional point where they can truly get treatment for whether it's a psychiatric or substance abuse issue. And we have a very strong care management focus, good relationship with HCRS, good relationship with the retreat, but we truly are that first step in a lot of folks' journey to resolve their issues, whether they're substance abuse or psychiatric issues. What's kind of astounding to me, and my last hospital was in Brockton, Massachusetts, and if anyone's familiar with Brockton, that's a community that has a huge substance abuse problem.
Not quite the sleepy little hamlet that Brattleboro is.
No. And, we had about 55,000 patients going through the emergency department there. And on any one day, you had 5 or 7 patients waiting for referrals out of the emergency department. So I put that into context with Brattleboro. Certainly we have an issue, but it's not at that magnitude of what I experienced in Brockton. But the problems are the same. To have an 11-year-old having suicidal ideation, to having a 15-year-old with a drug problem, that's heart-wrenching.
Yeah.
But that's what we pretty much experience certainly on a weekly basis. The other challenge for us too is, certainly the cost of care, because most of these individuals have to either be observed by either the sheriff's department, and each day this week when I come to the hospital about 7:30, I see the sheriff's car there. I know why they're there, for a one-to-one on a patient that's probably in the emergency department. And if they're not available, we have to go with Hunter North, which is our contracted security group that's well-trained in de-escalation and one-to-one kind of care. But that also puts a cost and a burden onto the hospital, because these are folks that do need that one-to-one level of care.
I think what we're pulling out of this whole thing today is that there are a lot of things that I think that we are learning today. First of all, I had no idea that you could hold people at Brattleboro Memorial Hospital for up to a week. I had no idea, literally.
In the emergency department.
In the emergency department. Yeah, that to me is really telling of a problem. I think that
it's not just BMH.
No.
You go around this state, it's every emergency department.
Oh, I'm sure.
And I think actually we're in a better position because of our association with the retreat and the community agencies here. Mm-hmm. There are other hospitals that don't have that kind of resource, especially at the retreat, to move patients to in a better setting.
It is. It's very telling. I'm sure that there are a lot of people out there that didn't even know that we had a methadone clinic in town as well before this broadcast. But did you have a question for us?
Well, actually, what I wanted to introduce Wendy Cornwell. She's also with Brattleboro Memorial Hospital. And Robin Reiske was speaking earlier about the Spoke program. You actually, Wendy, administrate the Spoke program here in Windham County. So we invited you today to talk a little bit more elaborately about that.
Okay, so
Please hold the mic up closer. Thank you.
as part of the project for the Vermont Blueprint for Health, and also in conjunction with Medicaid, in July of 2013, we rolled out the Spoke program in the Brattleboro Hospital service area. So the purpose of that program is to support a case management system around patients who are receiving outpatient office-based opioid treatment. And in Windham County, we have about 235 people that are currently engaged in this treatment program. So one thing I would like to really emphasize about the program is that it's very well staffed. For every 100 patients that are on Suboxone therapy, they have the services of a full-time registered nurse and also full-time licensed drug and alcohol counselor. So it's not just about giving patients medications to block their opioid receptors. It's about helping case manage their lives socially, physically, mentally, emotionally, and helping them get their health restored and get on the path to recovery so that they can become productive members of our community.
Thank you.
Well, and you talk about that Blueprint for Health model, and that certainly is new and part of the change here in how we deliver health care in the state of Vermont. And just one kind of final question for you and for Steve. When you're talking about some of these changes to the healthcare model, and to Steve's point about every hospital experiencing this same issue that Brattleboro Memorial Hospital is experiencing, do you feel these changes have given you the necessary resources to respond to the issue at hand here? Or, and keep in mind you have a senator here, if you wanted to talk a little bit about what else Montpelier could be doing to ensure that you have resources.
Well, Jeannette has been very supportive of us and a real leader in the legislative delegation for Windham County. I will tell you this, we are building a new state hospital, but those beds are going to get filled up as soon as they open. And it's also, but on the positive side, and I don't know, Jeannette, if you'll talk about the timeliness of medication, Bill?
Probably not.
Probably not. But, I think we can do things better in terms of how we're treating patients, especially for involuntary medication, because as we can get patients better able to deal with those, with their issues, and released from a hospital like the Retreat, you can move more patients through the system, and rather than having them linger in basically a psychiatric jail and an emergency department. That's the worst place for them. So I have a lot of hope now with some of the changes legislatively that are being made. There is certainly more hope with new state hospital, but I know that still that's not going to be enough.
Right.
And until you get to the source of the problem, we deal at the hospital with the results of that problem.
Yeah.
We will always have a problem.
Yeah. So. Wendy, you wanted to add something to that?
Well, I just wanted to say that
once again, please hold the mic.
Vermont is very unique, and that I'm very thankful for the resources that have been deployed by the Blueprint, by the commercial insurers and the non-commercial insurers, because we are fortunate to have the model of the community health team, and also the hub and spoke and these expert clinicians, because I think what we're seeing is that there are a lot of people in the community that have chronic health problems, mental health, physical health, and they need to be case managed very carefully. The office visits are very quick, and the primary care providers don't have the time to do the follow-up and go into the homes that I think really makes the difference.
Right.
So both the Hub and Spoke program and the community health team can really get on the ground and help with some of these long-term problems that are chipping away at our community.
Yeah, absolutely. We're up on a break right now, so we'll take a quick break here and switch out panels. I want to thank Steve Gordon and Wendy Cornwell for taking some time out today to join us on the panel.
Thank you.
And we will be back after these messages from Brooks Memorial Library with the Call to Action Forum on WKVT 100.3 FM and AM 1490.
Welcome back to A Call to Action, broadcasting live today from Brooks Memorial Library in the meeting room, a public forum that is dealing with our recent crime problems here in Brattleboro, opiate addiction and heroin addiction. Steve Gordon, was good to hear from him. So taking his place at the table, Brian Condon from Turning Point, and we also have Danielle Southwell from Youth Services, Bainca Berry from Youth Services, and Jeannette White, Windham County Senator here. Brian, if we could just start with you, just tell us what Turning Point does.
We're a recovery center, peer-based, basically, so most of the staff and volunteers there are also people in recovery, and we offer a safe, sober place for people to go, just to hang out, do some things. We have some activities there, computers, pool table, and kitchen and stuff like that, but we also offer a lot of groups and services for people that are in recovery. We're a nonprofit. We don't charge for any services that we offer, and it's a great place, to work on your recovery. Just one more tool that we can offer for people.
All right. Thank you. If I could, I want to speak with Bainca and Danielle, if we could. And you guys are working with what I have seen so far as kind of a youth-based problem with a lot of our opiates. And I don't know how much heroin you're seeing at that young age, but we know that it's popping up. And what are you guys doing to combat that? What are some of the things that youth services are doing to help out?
Thanks. So I'm Bainca. I'm here with Danielle, and together we collaborate and coordinate a program geared mostly towards 15 to 22-year-olds with a variety of different barriers and difficulties that are happening in their life. We've both been doing this work for 6 and 7 years now, and over that time we have not seen a lot of heroin use. I would say until the last year and a half, when we've definitely seen an increase. We're doing the best that we can with our clients to help them reach a point where they're interested in having an intervention made. They're interested in receiving treatment. They're interested in maintaining that treatment over time and staying sober. We have clients in all different stages of readiness, and we're kind of just trying to meet them where they're at and help them in any way that we can. I would say if you pull the scope back a little bit to look at our whole agency and not just our specific program, we have so many resources that are really working with more early intervention. Our intensive family-based services program, our mentoring programs like Big Brothers Big Sisters and the RAMP program, and our Young Mom mentoring program, trying to reach kids and do the sorts of things that Julie and Beth were talking about earlier, to engage youth in learning those important skills through role modeling and mentoring around being able to take care of yourself without having to rely on medications. And a lot of the kids that we work with are in pain, and they've had really hard things happen to them, and I don't blame them for wanting to feel better. It's just a matter of figuring out how to help them do that in a healthy way.
Okay, and that's in large part what youth services and all those organizations that work under that umbrella do on a day-to-day basis. Danielle, specifically, what is your job title and function? What do you do to kind of help?
Well, my specific job title is Assistant Director of Youth Development Programs, but some of the programs that I'm involved with include our Drop-In Night, which is a collaboration we do with the Boys and Girls Club. It happens every Tuesday from 6 to 8. And it's really the lowest barrier access point, I think, for many of the clients that we see. It's a place to come and get free food and to talk to people who are skilled and trained in order to help address a whole variety of issues. And we've seen an unfortunate increase in people who are coming there looking for help in getting into different types of detox or rehabilitation programs. We also have a shelter. We actually have a shelter and what we're calling a transitional program. One is in Brattleboro and one is in Bellows Falls. And I think one of the things we haven't had a lot of chance to discuss quite yet is just the root causes of this problem and the different points along the way in order to sort of prevent ongoing issues. So we haven't talked about the fact that there are very limited employment options specifically for youth, but in general, the cost of housing is not affordable in this community. And so the sense of hope is diminished because of those larger systems issues as well. So I think that part of what Youth Services does is not only like I said, the drop-in night and addressing housing issues and our case management programs, which really focus on harm reduction, and they're not abstinence-based. We want clients to feel comfortable to talk to us about wherever they are in terms of their use. And I think that we do a really good job at that.
I would agree with that, but those are interesting points that you make. If there's just doesn't seem to be any hope, if there's no light at the end of the tunnel, what's the motivation to kind of get off the drug and set your life straight if you're just going to be miserable? Yeah.
It's been interesting to me when we were assembling the 3-hour-long panels and who was going to be on it, that for this last one we were going to have folks from Brattleboro Memorial Hospital, Turning Point, as well as Youth Services, a lot of people who are on the front line of providing care and taking this new notion that Governor Shumlin had put forward about treating this as a health problem in addition to a law enforcement problem. Want to turn that now to you, Senator White, and talk a bit about that change, a little bit of a change in terms of the charge given to you in the legislature, both in the House and the Senate side, and certainly in terms of finding resources for communities like Brattleboro's and organizations in this community to attack this problem as a chronic health problem versus just a law enforcement problem in the past.
Thanks. Well, I think that, as Danielle said, that the root causes are, I'm not even going to go there about how we hopefully can address some of those, housing, employment, all of those. But I'm just going to very briefly talk about a couple of the things that we've done over the past 2 years that I think have, this is a hard issue to legislate.
Oh, yeah, there's no question.
So
and if I could interrupt, I'm sorry. Yeah. What we're looking for are kind of ways in to sort of help you do your job, and we're not here to put you on the spot and make you answer to these questions. Yeah. We want to hear, although we will. But what we want to know is, what can this community do that will help you?
Mm-hmm. Oh, well, that's okay. Can I first tell you a couple of things that we've done?
Please. Absolutely. Yeah, because people need to know.
So we have required now continuing education units for doctors around palliative care. That had never been done before. We have now required that. We have tried to deal with the biggest source of Suboxone misuse is in our prisons, because it's easily diverted. It's on those little, like, Listerine strips, and it gets diverted into the prison. So we've dealt with that by having increased search procedures and working with the Department of Corrections. We've increased the penalty for trafficking into the state. I'm not going to go into any detail on any of these. If anybody wants them, they can call me afterwards.
Yeah.
We've looked at pretrial risk assessments, because so many people who have substance abuse issues or mental health issues end up in prison because of their behaviors. They shouldn't be in prison. They should be getting treatment instead. So we've looked at pre-trial risk assessments that will be done on people, and then they will hopefully get treatment instead of being sent to prison. We've tightened up the precious metal dealers, and I know that sounds really silly.
No, it doesn't. Because I've read it. It does not sound silly, because there's a big problem with a lot of that.
There's a huge problem with that, and so we've tightened up who can be a precious metal dealer and the kind of background checks they have to do when they're when they're buying things and selling them. We've looked at increased penalties for new substances, and the substances that come on the street come so fast that you can't have a law for every one of them. I mean, last year was bath salts. This year it's powdered alcohol. Who knew that you could buy powdered alcohol, put it in a glass, like Tang, mix it up, and you've got alcohol. But you can also shoot it up or snort it. So we have a penalty for kind of new substances. We funded more for the hub and spokes so that there can be more hub and spokes. And we passed what's called a Good Samaritan law, so that if you're with your friends and your friend overdoses, you can, even if you yourself are violating your probation or you're using and you shouldn't be using, you can bring your friend to the hospital, you can call, they'll come, you won't get in trouble. And we've heard that that's already saved a couple lives. And the other thing is the use of this, what is it called? Narconon. It's if somebody's overdosing, you administer it to them and it opens their passageway so they can breathe again. And this is available to users themselves or to family members, close friends, partners, to have so that, and it certainly doesn't solve the issue, but it might help some people to live longer and hopefully get into some kind of recovery.
Well, I think that to anybody who thinks that our legislative body isn't doing anything, I think that speaks to the contrary. But this thing is a moving target.
It is.
And as quickly as you think you've got one head of the snake cut off, alcohol powder. You know, I mean, where did that come from? You know, I mean, and these are the kind of things that are constantly changing, and the folks from Turning Point, I'm sure, are seeing it. The folks from Youth Services are seeing it. Chief Wrinn, Lieutenant Merrigan, Harry Chen, all the people that we've had on our panel today are seeing this thing. They're like, good, all right, we got what? There's what now? Kids are doing what? And so it's a moving target, and to try to keep track of all this stuff has just got to be maddening. But when the things come up, how do they get presented to the legislative body? I mean, does it start with a boots on the ground campaign to basically say, we've got this problem here, we need you to create a new law?
Well, it can start that way. This is, and it could start that way with individual things like the precious metal dealers. Mm-hmm. That somebody came and said, this is a real issue, we've got to deal with this. But in terms of the kind of whole problem, I think that Governor Shumlin, in his State of the State address, or whatever, I think it was State of the State, mm-hmm. Identified this as something we were going to work on this year. We worked on the Judiciary Committee, we worked really hard on this. The pretrial risk assessment is a huge issue, and it took a lot of time and a lot of effort. The other one that took a lot of time and effort was what Steve was talking about, the timely access to judicial review but that's primarily mental health patients, so I'm not going to go into that now, but if anybody wants information on that, I'm available. But so it can come that way, or it can, if people have particular solutions, that's very helpful to come forward, because, and that doesn't always say that the solution that you have is the solution that we're going to come to, because for every solution, somebody has the opposite opinion.
Right.
And the point up there is that you have to have 180, it's 76, 16, and 1. You have to have 76 House members vote for something, 16 senators, and 1 governor. So unless you have those numbers,
what was the last one? One governor. Okay.
One governor. But so unless you have those, it doesn't work. So you have to. I mean, there are people that think that the way one of the ways to solve this whole issue is to just not have a Schedule II, or to legalize drugs. Then you won't have the black market, you won't have the drug trafficking, people will be out in the open, they will, and then there are people who disagree with that. So someplace in between is where we have to come.
Sure, absolutely. Absolutely. We have to go to a break, but Beth, you have a quite. Don't point at me like that. You have a question, a statement.
One of the things that you said, what could the legislature in this House do, is Youth Services, BAPC, other organizations are constantly writing grants and seeking funding to help our clients. Mm-hmm. If there was some dedicated funding for these issues, so that we're not competing all the time against I'm competing against Cindy Hayford in Deerfield Valley for the same money, and Julie's competing against other people for money. We're so busy competing for money to provide our services. If there was some way that we could look at this issue with some constant stream of funding so that we're not constantly writing grants and not constantly competing to help families and to help youth, that would be a tremendous asset into helping us to address some of these issues that we've talked to you about today. So I'm going to pass this to Julie.
And particularly increasing the ratio of funding that comes into Windham County. For instance, about 2 years ago, I participated in a statewide look at the system for treating adolescent and young adults. And Windham County was among the highest level of perceived risk of youth and young adults using, yet the lowest corresponding treatment available. Then the state received a grant through SAMHSA, and apparently they needed larger numbers. So the funding didn't come into our region to address this issue. I had a conversation with the state. They weren't able to dedicate any funding to this area. So it would be helpful to see the funding ratios revised so that we're getting the resources to meet the need in this community.
I totally agree.
So that's good stuff. All right, now I know we're up against a break, and we've talked a lot about how to do these things on a front line. And when we come back, we're actually going to speak to somebody who is literally been on the front line, maybe had that blue light moment. Jed Pop, who's going to come on and tell us his story right after we return. You're listening to A Call to Action on 100.3 FM and AM 1490. It's Fish and Chris Lenois.
Welcome back to Brooks Memorial Library. Chris Lenois and Fish hosting A Call to Action, this special forum about heroin addiction and drug-related crime in the Brattleboro area. Been listening to it live on WKVT 100.3 FM and AM 1490. Rapidly coming to the end of the hour here, and certainly there's any number of topics and angles and different ways we can come at this from. As we were saying earlier in the show, this is just a continuation of a conversation that I've been having on Live and Local with Fish, as well as other people in the community want to continue it afterwards as well. And before we get to Jed, who Fish set up in the break, we have Scott, a member of the community here, with a quick comment about what he's hearing today. Go ahead, Scott.
Just in the last year, I've seen bicycling. I don't go through Brattleboro a whole lot, but driving through and bicycling through, I've seen drug deals going on Ellie Street. I've seen cars parked on Canal Street where guys trying to flag you over and hey, they're strange. I've never seen them, and they don't know me, but they obviously have drugs to sell. And but my main point is, and this is something that's gets to the root of the problem, the real source of the problem. And like in the last forum that was held in Massachusetts, it was mentioned by some official that the true source of these drugs is coming in through South America. Well, that's not really true. Heroin is mainly coming now from Afghanistan. Anybody can do a Google image search on opium and our U.S. soldiers and see pictures of our soldiers not eradicating opium poppy fields in Afghanistan, but protecting them for the CIA. And it's not conspiracy theory anymore, but there's mainstream articles by mainstream reporters and they've written books about the CIA drug running, and whistleblowers from the CIA and DEA have talked about they've gotten caught running drugs. And if you just do the math, this is something that our president should be addressed by our governor and our congressman about long-running CIA drug. There's mainstream movies done about it, Air America and Double Cross. And the point is, if we really want to, get to stop out the problem. For instance, I live in a rural area. If I would leave my windows and doors open, I'd have rodents in my house. And rather than just fighting off the rodents, maybe I should close the windows and doors. We should demand that our governor demand that the president stop CIA drug running. Tons and tons of heroin and cocaine come into this country, and you could do the math. You add up all the busts, at the border, some cowboys, running a few kilos here, or a cigarette both here.
We certainly haven't seen any poppy fields out in Dummerston, so certainly it is an issue that for the community here that needs to expand beyond to this national level and to the global level when we talk about the source of opiates and heroin, and definitely appreciate your perspective on that. And during what Scott was saying, as well as during almost every other presentation here, Jed Pop has been sitting right in front of me here and nodding his head a lot and writing some notes as he talks about this. Jed, please share with us why you're here with us today at this forum.
Thank you, Chris, and thank you, Fish. Can you hear me?
Yeah.
Doing good.
Well, I'm a recovering heroin addict, and I've lived in Vermont almost my whole life. Born and raised in Middlebury. You know, when I was young, I had problems. I was youngest of 7, and we're talking about the cause of, the root causes of addiction. For me, it was right there. Counselors, therapists, and when I got to, point when I was going through puberty, I didn't want to go to the doctors anymore, and so, I found alcohol. I started smoking pot, and then pills came, and cocaine came, and then at work one day I sliced my fingertips off on a mandolin, and I went to the emergency room, and they gave me a prescription for 6 Vicodin. And the next day I took one at work, and it was fantastic. I'm not gonna lie. But anyway, through about 12 years of using, I soon began to use heroin shortly after that, with prescriptions, with different pain medicines, weak and strong. It ended up at heroin, and I think that's where the problem lies now, along with the prescription pain medicine. And I hear what everybody's saying, and having this forum is the first thing, in my eyes, the first thing that we can do to bring everybody together, because I think all these programs, it's just not about the hospital getting together with the retreat and with HCRS. It's about the hospital being involved with everybody, with the Turning Point, with Habit OpCo being involved with everybody. I'm almost ashamed to admit that I'm part of Habit OpCo because of everybody's opinions. This is my second time there. The first time there, yes, I was using. I did not go to any meetings. I had no recovery. But after losing completely everything, a fiance of 9 years, the respect from people in my life, my friends, I lost everything. And I came over to Brattleboro because of all the programs. And I think, to look at the positive side of things, this community is very prepared for this, if you want to call it a war. I think a battle would be better suited, but that's why I came over here, to all these programs. And I was homeless, and one night I was hopeless. I was having a hard time seeing the light, and I said to myself, I'm either gonna just go off and never come back, or I'm gonna try. And from that night, I woke up feeling fantastic. No idea why. I was wet from the rain and cold, and I've made it a point to pay attention to everything that I'm learning, to pay attention, to meet people, to be positive, and there's programs like Pathways. Housing has helped me. That was the #1 thing, was having a safe place. Being on the streets with the dealers and with everybody. That I won't go into it. But housing, therapy, the retreat is one of the most excellent places to go to. As far as the clinic goes, I see where people's opinions are coming from, and I hear that. And I've spoke to the director about making it more of a rehab rather than going and getting your legal fix for the day. But in simple terms, they're for profit. It's not going to be like that. The governor's going to have to step in and do something about that, because in my eyes, places like that need to be not for profit. And the Turning Point and meeting Brian. I was there about 2 years ago and things didn't work out, and I came back and I got together with Brian and started a new group for people who can't connect with AA or NA. Places like the Turning Point see things from different points of views, and they offer things that other programs don't offer. And I'll let Brian talk about the whole moving thing, but
well, I did want to ask Brian from Turning Point of Windham County, in terms of what you're hearing from Jed, in terms of how typical his story is, in terms of other people who access services at Turning Point.
Yeah, very typical. And we see a lot of different people in different kind of addiction, alcoholism, opiate addiction, and other ones. But they're all very similar, if not very much alike. And just to emphasize the recovery, and I think, like, if any message today that we can bring here is that there is hope for people. There are, we've heard from so many great people today that offer services and stuff just to help people and stuff. And I think Brattleboro is actually a great place for that. Recovery town, we're referred to. And if people utilize that and we get enough funding and stuff, there's very much a lot of hope, for people. And people like Jed that are doing really, really well, and people do get better, and there is a lot of positive, to think, to help with the problem.
Well, I look at Jed, and he's the best dressed person in the room, which is great. And so I did want to ask you, Jed, in terms of coming to this community and hearing that you might be able to find some services to help you in this community, be interested to know, your own turning point in terms of making that decision, but also where you are now. You talk about a lot of these things about losing job and being homeless. So where are you now in 2014?
Well, first of all, Chris, I got these clothes at the drop-in center free.
Bravo.
Which they are, immense in my recovery.
It's a sweet jacket.
I like it.
It is nice. It fits you well.
Yeah.
Thank you.
It's a theater of the mind medium, so we have to let everybody know. I mean, BCTV's here. Thank you.
Well, I'm involved in a couple therapy sessions a week. I'm involved in a few groups a week. My recovery's full-time. It's hard having no money and two cats. Raising two cats with no money. But my situation could be worse, and I'm very grateful for the things that I have. I do a lot of volunteering. I feel like being active in recovery is very important. And I just moved into a new apartment. Things are not easy right now, but with the tools that I've learned in the past 2 years, I am better suited to face any issues that may arise. My mother's sick, and my mother's dying from emphysema. Well, there's certain techniques that I've learned along the way that are going to help me with that. I don't know what's going to happen when that time comes, but I've built an incredible support system, and in AA, I choose to go to AA rather than NA. Everybody's recovery is different, and that's very important to know. I could be somebody's brother or somebody's father, somebody's coworker. I could be the governor. I could be the mayor of Toronto. I could be any.
Don't go there. Don't go there.
Yourself to that.
Yeah, you're better than that.
But it's just I'm very thankful for that I've built my life, and I'm in a fantastic place because of these places helping me and because of the want to do it.
And Jed, you're speaking to people in this room in a very moving way, and also to listeners on the radio right now and to BCTV, and you bring up mothers and brothers and fathers and that impact on a family. If you could please just to kind of help us close out, a message to them in terms of how they can respond, how they can help their loved ones in these situations that you found yourself in, as well as people out there who might not be realizing exactly what path they're going down.
Good question. I feel being aware, knowing what you're up against is very key. Being open and being honest, like John was saying, Lieutenant John Merrigan was saying. And also, one thing that sticks with me is I've lied so many times. Nobody believes me, so why even bother? When I'm going to be telling the truth right now. Don't listen to what they say. Look at their life and see how if they're doing good in their life, well, they're doing good in their recovery, and just be aware. And when you first see these symptoms, do something about it. Don't stand back. You have to do something about it. Step in.
Thank you, Jed. For sure. And I mean, there's coming right from a person who's realizing these services, and also speaking in large part to how hard a road to recovery is. And if we can enter into these things, and maybe Bainca and
you can continue to the top.
Maybe Bainca and Danielle could speak to maybe not being so quick to judge right out of the gate somebody's what you might see as a face value, somebody who has been in an addiction mode, and what that person might look like. And I think Jed painted a really good picture of what that looks like. And as a society, our less than willingness to sort of stand back and go, I don't want anything to do with that. And Jed closing it out by saying you need to do something about it. I mean, do you find that is what we need to do, is maybe not have as much judgment entering into these conversations?
I think part of the problem in the community is that people are so quick to judge, and there is so much sense of, I can't go out at night, it's not a safe place. And I understand wanting to be cautious, but I also think that behind every person who one might identify as an addict is somebody who has the seed of love in them and wants to be loved, and that's really what most people are seeking. So I guess I would just leave it with that.
Okay. No, I think that's very important. Brian, you would agree?
Absolutely. Yeah. Yeah.
Okay, great. And Jeannette, look, we know you're doing a lot of hard work up on a state level, and Jeannette is one of the most approachable senators that we have in this county. So we thank you for coming on and being a part of our panel, and for letting us know all the good work you are doing up there on that level. If I were going to, I guess, bring this thing down if for the past 3 hours to one simple point, you just can't. Because as we've discussed, this thing is a moving target. Jed has said his recovery is different. He doesn't go to NA, he goes to AA. Maybe he feels more support there. There is no one simple answer to this huge overbearing problem that is on us. Folks like Sue Avery, and your organization again, Sue? Narcotics Family Group, who offer support. Turning Point Youth Services. We've heard from the Brattleboro Retreat today, Brattleboro Memorial Hospital. We've had a lot of eye-opening moments. Robin Reiske's been here, and the Brattleboro Area Prevention Coalition. I mean, all of these people, all of these services, and Jed spoke to how many of those services helped him and why he's here. And we welcome you to be here and to stay and be recovered and stay in recovery. But just getting involved is number one. It's catamount to all this. Paying attention, counting your pills if you have to have pills in your home, counting your pills and keeping that front and foremost. So that would be the takeaway thing that I would have here, Chris.
Absolutely, and to keep talking to each other, keep sharing your own experiences, keep sharing your experiences that you're hearing from your friends and from your family members, and different ways that we can come at this problem, because it is a complicated issue, and it's not going to be the same answer every time for each person that is individually going through this. So I think, again, this is a to be continued conversation. We're out of time here for the radio broadcast today, but I can't even thank everybody here who came on and helped and shared their stories today, as well as all of you out there who just came to listen today. I appreciate it. And we do make all these available by podcast on WKVTradio.com.
There's our plug. Thank you.
And I really want to thank Fish for throwing this panel together. It did a fantastic job and allowing Alive and Local to host it. So thank you so much.
Thank you for doing it. All right, everybody. Thank you so much for attending and listening at home. We'll throw it back to the studio.